Do you feel the buzz?
Can isolate without fear of losing their jobs. We need a system immediately. We've been calling for it for months and months and months, as he knows. And on testing, I mean, he told us a few moments ago to get with the programme, Mr. Speaker. We just want him to deliver testing for our constituents, Mr. Speaker. We've had examples after examples of people being told to go hundreds of miles. In Telford, the borough has been gridlocked because the system has been telling everybody to go to Telford. And yesterday, he was touring TV studios trying to dampen demand, even though he previously told this House in July, this was his quote, "If you have symptoms, if in doubt, get a test." That's what if in doubt. He was telling people to get tests, Mr. Speaker. So having encouraged people to get tests, and with 8 million pupils returning to school, with thousands going back to workplaces, as his Prime Minister has insisted upon, surely it was obvious there would be extra demand on the system, and why didn't he plan extra resource capacity to process tests? It isn't the fault of ill people asking for tests, Mr. Speaker. It's his fault for not providing them. And we had no apology today to our constituents who have been told to travel hundreds of miles for a test. And having failed to provide the tests that people need, and by the way, having failed to provide wider diagnostic tests, the waiting list for diagnostic tests has hit 1.2 million today. That's the highest on record. He now wants to deliver 10 million tests a day as part of his so-called Project Moonshot. Now, I've long been pushing him for a strategic mass testing regime from the start. The World Health Organization told us to test. But we are all fed up of undelivered promises and world-beating. Mass testing is too important to become another failed project. It's all well and good, him talking about moonshots and the Prime Minister telling us we'll be tested every morning. Even better would be simply delivering the extra testing that is needed now, not just headline figures. So I have some very specific questions. First of all, the Prime Minister told the nation he wants this in place by spring. The Chief Scientific Advisor pointed out it's completely wrong to assume this is a slam dunk that can definitely happen. So how quickly will this be delivered, and how quickly will the pilots in Salford and Southampton be assessed? Secondly, what is the cost? According to the British Medical Journal, leaked documents suggest the cost will be £100 billion. Is this correct? If it's not correct, can he tell us what his estimate is of the cost of processing 10 million tests a day, and can he tell us how much has been allocated to Project Moonshot? Thirdly, who will deliver it? There are universities piloting projects, like University of Leicester, who are rolling out LAMP testing. What discussions has he had with them? But it's reported that he has already signed agreements and understandings for this project with GSK, Serco and G4S to deliver this. What procurement processes have been undertaken, and can he tell us if that is correct? Fourthly, what are the priorities? He's still not testing the loved ones of care home residents who are desperate to see relatives. And when will the government actually deliver the routine testing of all frontline NHS staff that we've been demanding for months? Mr. Speaker, effective testing depends on quick turnaround and local access. It depends on effective contact tracing. Given he's not even been able to deliver these basics, how on earth do we expect him to deliver this moonshot?
Secretary of State.